Hello, everyone. My name is Chawin Lopimpisuth. I'm one of the residents at the University of Miami, Jackson Health System. Today, I would like to thank the GIE Journal for giving us the opportunity to talk about our research today. On behalf of all my co-authors, I would like to present our work titled Postprocedural cholecystitis following covert self-expandable metal stents placement in patients with distal malignant biliary obstruction, a systematic review, and meta-analysis. For our background, over the past decades, biliary self-expandable metal stents have been recognized for their superior potency comparing with the plastic stents, which usually are susceptible to occlusion because of the formation of biofilm, biliary sludge, and debris. Therefore, the most recent ASGE guidelines recommends using the self-expandable metal stents or plastic stents for patients with confirmed malignant biliary obstruction. Later, covert self-expandable metal stents were developed to prevent the tumor ingrowth through the mesh to prolong stent patency. However, there were safety concerns with post-ERCP cholecystitis, which has been gradually reported over the past decades. Despite multiple well-designed studies comparing covert and uncovered metal stents, this adverse event remains unclear. The recent meta-analysis showed no difference in the risk of developing cholecystitis. Therefore, the ASGE guideline mentioned the potential risk of acute cholecystitis, but without sufficient data, the recommendation still favored covert self-expandable metal stents over uncovered self-expandable metal stent, with the tip of the stent should be placed below the cystic duct orifice as possible. We aim to conduct a comprehensive systematic review and meta-analysis to compare the safety of covert self-expandable metal stent to uncovered self-expandable metal stent in the management of distal malignant biliary obstruction. For our result, we include 21 studies with 9 randomized controlled trials and 12 retrospective studies. With a total of 5,753 patients, of note, 15 studies included only a patient with gallbladder in situ. Firstly, for post-procedural cholecystitis, 21 studies were included, showing that the covert self-expandable metal stent had higher rates of acute cholecystitis when compared with the uncovered self-expandable metal stent group, with a relative risk of 1.71. Additionally, the subgroup analysis with only studies that confirm a gallbladder in situ had significantly higher rate of cholecystitis with a relative risk of 1.93. Secondly, for post-procedural pancreatitis, 19 studies were included. There were no significant difference between two groups, with a relative risk of 1.3, but a p-value of 0.07. Lastly, as suspected, we found there were lower rates of tumor ingrowth in the covert self-expandable metal stent group with a relative risk of 0.13 and a higher rates of stent migration with a relative risk of 7.53 when compared to the uncovered self-expandable metal stents group. In our conclusion, our study include 21 studies with a primary focus on the increased risk of cholecystitis following ERCP with covert self-expandable metal stents placement when comparing to uncovered self-expandable metal stent placement. We are the first studies to draw the attention to the exclusion of patients with a history of cholecystectomy, which has not been done before. We suggest thoughtful selection and consideration of patient's factor, such as gallbladder in situ, to optimize patient care, reduce adverse event, and to prevent delays in oncologic management. Finally, we are honored and grateful to present our finding in the GIE journal, and thank you again for publishing our work.